My name is John Martens, and I'm a general and peripheral vascular surgeon. When I talk about vascular surgery, I'm talking about the blood vessels that take blood to your tissues. There are specific arteries in the neck and in the abdomen and in the legs that are common targets for blood vessel surgery, and these are often abnormal in different ways, and our job is to fix those. When the blood doesn't circulate properly, there is a risk for limb loss, so an amputation can often be necessary when there's not enough blood. Some of the things and signs and symptoms that we look for are, for example, in the early stages, a person might notice that their leg gets very tired when they try to walk any distance. That will be a sign that there's blockages occurring. And then as things get more severe, we see more severe signs, which would be wounds that don't heal, and then often people would experience pain in whatever area that's not getting enough blood. That's because the tissue, when it's not getting enough blood, is putting out toxins and other signals to the body that says, this is not good, we need more blood flowing. If the artery blockages get severe enough, we would often recommend intervention to open up the arteries. The people that we choose for intervention are those with wounds on their legs, which are not healing because of a lack of blood flow. They're people with enough blockage that they're not able to sleep at night. And some of them are just people who have difficulty walking. So those are all reasons why we would intervene. And the intervention is, again, very much tailored to fit the patient. We work really hard here at Goshen Health to prevent amputations and to save people's legs and arms. It is extremely important for people to know if they have peripheral arterial disease. Not everyone with peripheral arterial disease needs an intervention, but those people definitely need optimization of their medical treatment so that their risk factors are modified, if they're diabetic, so that their blood sugars are well controlled, that they're on appropriate medications for reducing their risk for atherosclerosis, the artery narrowing process. Those people need to be monitored and to be treated so that they hopefully prevent them from getting severe enough to require these more aggressive interventions.